In global politics, certain moments define the course of history. A single decision can reshape alliances and power dynamics. Analysts say the recent actions of Donald Trump's administration mark one such turning point: the breakdown of US-India relations. The trigger was Washington's new wave of trade measures, 50% tariffs on Indian exports, which Indian businesses viewed as both an act of betrayal and a direct assault on their economy. According to the Financial Times, within weeks of the tariffs taking effect, India's exports to the United States plunged sharply, especially in key industries such as textiles, pharmaceuticals, and IT services. Companies that had relied on the American market for decades were left reeling. In New Delhi, officials are making it clear they won't tolerate this indefinitely. As reported by the Economic Times, Prime Minister Narendra Modi's government is preparing countermeasures that go beyond symbolic gestures, steps that could strike directly at the heart of the Trump administration. India's strongest card is its pharmaceutical industry, an area of critical dependence for the United States. Over 40% of generic drugs used by Americans come from Indian manufacturers. India leads the world in producing antibiotics, diabetes medication, and key cardiovascular treatments. New Delhi's decision to restrict the production of certain drugs has sent shockwaves through Washington. Indian officials have emphasized that life-saving medicines like insulin and cancer treatments will not be targeted. Still, the supply of dozens of common drugs, including painkillers and broad-spectrum antibiotics, could be reduced within months. A senior official from India's Ministry of Commerce told Reuters, "The message is simple. What's at stake isn't trade numbers, it's human lives." Behind closed doors, Indian lawmakers are using sharper rhetoric. One member of the ruling party told the Hindustan Times, "Trump must choose between his political ego and the health of ordinary Americans. If he continues this trade war, his reputation will pay the price." The US dependence on Indian pharmaceuticals runs deep. Producing generic medicines requires vast industrial capacity, a skilled workforce, and government-backed infrastructure that India has spent decades developing. Pharmaceutical hubs in Hyderabad and Gujarat have become global centers of affordable drug manufacturing, with production costs 30–40% lower than in the US. American corporations like Pfizer and Johnson & Johnson have long outsourced parts of their supply chains to India. The US could attempt to restart domestic drug production, but the Wall Street Journal notes it would take years and billions of dollars, as the necessary infrastructure doesn't exist. Even the raw materials, active pharmaceutical ingredients, APIs, largely come from India and China. If India were to halt exports, US pharmacies would face shortages within weeks. The White House has reportedly convened emergency meetings with health officials to explore backup options, from third-country sourcing to accelerating domestic production. But even under the most optimistic scenarios, experts admit such measures would take months, if not years, to stabilize supplies. Indian officials insist the move is political, not humanitarian, aimed at Washington's policy, not its people. Yet economists warn the consequences could be severe: drug shortages, skyrocketing prices, and millions of patients left vulnerable. Analysts at the Brookings Institution call it one of the boldest economic pressure tactics in modern history, noting that for the first time, India is using control over medicine, not tariffs, as leverage in a trade conflict. The domestic reaction in the United States is polarized. Some Republican lawmakers demand that Trump retaliate with harsher tariffs and tighter visa restrictions for Indian IT workers. Meanwhile, Democrats accuse the administration of recklessly endangering public health. One senator told CNN privately, "The president has risked the lives of Americans for his trade rhetoric. That's indefensible." Experts agree that India's response crosses a red line, yet many also see it as a moment of truth for Trump. Will he keep escalating and risk the health of his citizens, or will he return to the negotiating table? Public opinion is divided. Some view India's move as a justified response to economic aggression, a show of strength by a nation tired of being exploited. Others warn it's a dangerous game that could turn patients into hostages of politics. Either way, the trade war has entered a deadly new phase, one where medicine itself becomes a weapon. According to Nikkei Asia, BRICS nations are already quietly discussing a medical alliance with India at its center, supplying affordable drugs to Africa, Latin America, and even parts of Europe if the US market closes off. For India, this could solidify its title as the pharmacy of the world. The irony is that the US once encouraged India to build this very industry, as cheap generic drugs helped lower healthcare costs for Americans. But now, that same dependence has become Washington's weakness. Sources within India's government told The Hindu that the export restriction plan had been in preparation since spring, long before the tariffs were officially announced. Ministries of Health and Industry had quietly compiled lists of drugs that could be limited without harming domestic needs, weighing political impact against humanitarian concerns. New Delhi is careful not to overstep. Officials know that if the US accuses India of creating a global health crisis, it could damage the country's reputation. That's why the proposed restrictions are categorized, from common antibiotics and painkillers to antiviral drugs, ensuring essential medications remain available while still applying strategic pressure. Within India, the move is being hailed as historic. The Times of India ran the headline, "New Delhi wields medicine as a weapon for the first time." Across major cities, rallies support the government's firm stance. Many citizens argue that India has long been dependent on US markets, and it's time to assert independence. On social media, the hashtag #PillsForPower is trending, symbolizing a new era of medicine as the weapon of the 21st century. Some experts draw parallels between this and Russia's gas disputes with Europe, except this time, the vital resource isn't energy but medicine. In both cases, control over a life-sustaining commodity becomes a geopolitical weapon. And that is what makes India's move both dangerous and powerful. The world now watches as trade policy turns into a matter of life and death. Whether India's bold step is seen as justified resistance or reckless brinkmanship, one thing is certain. Trump's trade war has escalated far beyond economics, and its consequences may be felt in the hearts and lungs of millions.